Lehigh Valley Hospital has helped me to grow from the medical student that I was when I got here into a young surgeon that I am now. And it's made a big difference, and I feel like I'm ready to go out and face the world as a surgeon.
I wanted to come here because I knew I'd get trained well as a general surgeon. Regardless of where I wanted to go at the end, I'd be able to do everything that a general surgeon across the board is capable of doing.
One of the things that really struck me was how happy the residents were, and for surgical residents to be happy 9 times out of 10, it means that they're getting into the OR.
I found that this program has been even a better fit than I thought it would be. We have great operative experience. You get in early, you get in often. You have attendings who are very intelligent and willing to teach.
I think especially over the past year, my surgical skills have dramatically increased, and I find that what I was looking for in a residency program, which was obtaining strong clinical and surgical skills, has been a goal I've been able to achieve.
Hello, I'm Mike Battolino, Program Director of the General Surgery Residency. I'm pleased to have this opportunity to tell you about our educational programs. We provide our residents with an opportunity to work in one of the busiest trauma centers in Pennsylvania and to train in a surgery department dedicated to education, research, and patient care. The General Surgery Residency focuses on developing your surgical skills and enhancing your medical knowledge through practice-based learning and improvement and systems-based practice.
Not many hospitals have the degree of commitment to advanced technology that Lehigh Valley Hospital has. We all have Lifebook computers, we use a sophisticated computer order entry system, and we work with digital radiography and other advanced systems.
Everything's at your fingertips. Even before you see the patient, you can look up their history and physical, their medication lists, what previous studies they've had in the past. And then when you do evaluate a patient, just at point of care, you can order diets, labs, studies.
I'm Paul Mosca, Associate Program Director of the General Surgery Residency. As a resident, you'll benefit from working alongside a distinguished team of board-certified surgeons performing a wide variety of surgical procedures. Our excellent surgical specialties include surgical oncology, kidney and pancreas transplantation, pediatric surgery, cardiothoracic surgery, colorectal surgery, plastic surgery, trauma and critical care, vascular surgery, urologic surgery, orthopedic surgery, and neurosurgery.
My experience just in my first year has been all over the place, where I've seen and been able to participate in the care of a varied number of patients.
The surgical experience here is very diverse. As a regional referral center, we have many surgical subspecialties, so you get a very well-rounded education.
When it comes to transplant, trauma, cardiothoracic, pediatric, a lot of patients that would have had to go to Philadelphia end up staying here.
As a resident, you'll perform inpatient and outpatient surgeries, developing your surgical skills and learning to put together patient care plans. You'll also work with surgeons specially trained in a wide variety of laparoscopic procedures, including bariatric, colorectal, and general surgical procedures. As your knowledge base and experience grow, you will perform increasingly complex operative procedures.
I've done thoracoabdominal stents, I've done plain abdominal stents, plain thoracic stents, and these are all endovascular and very complicated.
Isolated limb infusion surgery is something that's highly advanced that not a lot of places in this country do. This woman had a sarcoma of her arm. We put 2 catheters in the vessels in her arms and were able to infuse high doses of chemotherapy to treat her advanced cancer.
I personally love thyroid and parathyroid surgery, the endocrine surgeries. It's just a niche that I really enjoy.
Hello, I'm Thomas Whalen, Chair of the Department of Surgery at Lehigh Valley Hospital and Health Network. Along with our 5-year general surgery residency program, we offer programs in 3 surgical specialties: colon and rectal surgery, plastic surgery, and surgical critical care. Each of these specialty programs offers a quality education based on our high patient volume, advanced surgical and critical care units, and our dedicated attending surgeons. I'd like you to meet our 3 program directors and learn more about these exciting opportunities.
Hello, I'm Robert Murphy, Director of the Residency Program in Plastic Surgery. Our 3-year program is nearly 60 years old, one of the first plastic surgery residencies in the country. As a resident, you'll perform a wide variety of reconstructive surgeries, including cosmetic procedures, and gain experience as a primary surgeon. We admit more than 700 plastic surgery patients each year, with an additional 1,200 patients treated on an outpatient basis. Through our regional burn center, cancer center, and level 1 trauma center, you'll have opportunities to treat serious burns, facial fractures, cancer reconstructive cases, hand traumas, and more. Training to perform microsurgical reconstruction, including free flaps in the operating room, is provided in our microsurgery and laser lab. Plus, our cleft palate clinic offers opportunities to treat cleft palates and lips. Additional experience includes our cosmetic surgery service, where you will evaluate and become the primary surgeon in 25 cases during the year.
Hi, I'm Dr. Bob Sinnott, Program Director of the Colon and Rectal Surgery Program. Our fellowship provides a tremendous opportunity to gain expertise in the management of diseases of the colon, rectum, and anus. You'll work closely with a staff of colon rectal surgeons who have more than 100 years of combined clinical experience and are recognized on the national and international levels. Through this balanced program, your experience will include the evaluation of patients in both the inpatient and outpatient setting, as well as the development of treatment plans. You will perform major abdominal and pelvic procedures, both open and laparoscopic, as well as a wide variety of anorectal procedures. You will gain experience with procedures for inflammatory bowel disease, colon rectal cancer, rectal prolapse, and complicated diverticular disease. In our pelvic physiology lab, you will gain experience with computerized anal manometry and endorectal ultrasound for the evaluation of anorectal and pelvic physiologic disorders, as well as the staging of rectal cancer. Each year, several thousand colonoscopies are performed by our physicians and fellows, allowing you to hone your diagnostic and therapeutic skills. Your education will be further enhanced by attending our weekly multidisciplinary colon rectal tumor board, where we discuss all colon rectal cancer cases, review imaging studies, and finalize treatment plans.
Our one-year residency program in surgical critical care offers you an opportunity to train at Pennsylvania's first Level 1 Trauma Center. Each year, more than 4,000 patients are admitted to our trauma center, with 1,000 of these trauma victims flown by our University Medevac service. As a critical care resident, you'll have an opportunity to train with a multidisciplinary trauma surgical critical care team that supervises a trauma operating room, 2 trauma resuscitation bays, a 12-bed trauma neurosurgical ICU, a 7-bed surgical ICU, and a regional burn center. Our trauma critical care surgeons are available in-house 24 hours a day and are committed to teaching.
The curriculum of each of the surgical specialty programs is tailored to meet your individual needs and interests. You'll learn from didactic lectures, journal club, morbidity and mortality reviews, tumor boards, as well as surgery grand rounds.
The scope of the didactics in this program is very wide, from morning meetings to lectures and rounds.
There's ample opportunity for lots of research here. We've done anything from endocrine surgery to transplant surgery to trauma critical care. It's all available. They have a great staff here that can help us.
The media department's able to help us with posters. We have full-time statisticians to help us with the math, and full-time editors to help us with putting things together.
You can generally find an attending who has 3 or 4 projects that they're like, oh, how about this project? Why don't you get involved with me on this?
I was interested in oncology, and particularly colon and rectal oncology. I was able to start a number of projects with a number of different attendings, and have since presented at a number of regional and national meetings and have some articles in press.
Residents have a lot of opportunities to educate. In fact, every day we are students, but we are also educators. We rotate with medical students and also junior level residents.
I'm an intern this year, and my responsibility is to teach the medical students, and the upper year that I work with has to teach me, and our attending will teach anyone and everyone who's there.
Overall, the feel of the program is that we're in it together. We're here to learn, we're here to improve ourselves.
There's more than enough operating to go around. On call and at night, we really have a team atmosphere in terms of getting the job done.
I'm incredibly happy that I came here. I'm incredibly happy that this place allowed me to get my fellowship and one of the premier programs in the country for vascular.
What you see is what you get. We operate a lot, we work a lot, but it's all enjoyable. It's not a lot of scut work and things that you have to take care of doing. It's patient care, which we all enjoy.
As you have seen, we offer an outstanding opportunity for learning in a diverse and innovative clinical and educational environment. We look forward to meeting with you to discuss our program further.